presentation. We're gonna have a small Q&A at the end where we stop the recording, and just to have the dialogue, questions you might have about our program or questions in regards to the presentation. So again, my name is Juan Jimenez, and I'm with Phoenix House and the prevention team and your youth opiate response team. I have Claudia, Julian, and Steve here today with this presentation. Now, it does say part 2. If you missed last week's, don't worry. We're actually going to review a few of the topics from last week, and we embedded them with this week's presentation to kind of create a, just to review, last week was a, part of it was more bath salts and the designer drugs introduction. Today, we're still going to talk about the synthetic drugs, quote, designer drugs, but we're actually going more in depth into a couple of different ones. And we're going to link all this information with more synthetic drugs like opiates. And we're going to talk about more of those and health effects, a couple of them, what they are, just identification. And so that's going to be the conversation today. So we bring about a lot of information. Julian, myself, Claudia, and Steve, we are, all of us are substance abuse counselors with a residential background. Most of us have worked with the youth ages 12 to 17 residential atmospheres. And we were always, we actually did work together, all of us. And we knew really well how to being able to talk to the youth and being able to, motivate the youth, find the answers that the youth are always seeking for change. So just a courtesy, please mute yourselves. We will have a moment at the end and we're all going to have a conversation, hopefully, able to talk about if you guys have questions with synthetic drugs, these designer drugs here that some of us have heard of and some of us have not. Some of these you've actually heard in the news, and we'll talk about it a little bit as we reach those. So a little bit on the outline what we're going to talk about today. So we're going to review the designer drug. We're going to have Claudia talk about that, and she's going to give an overview of what they are, a little bit more of the chemicals and just more in details. We're going to have Julian talk about the review of the Federal Analog Act, and he's going to give us more of the legislation, a little bit more of when did this piece take an effect, and just a brief description. It's a long piece of legislation, and we would probably spend the whole afternoon and evening talking about it. So we're going to give you a small synopsis of it. So we're going to talk about common health effects. These effects are online journals that we found information and actual health effects that we've experienced working with the youth in residential. Synthetic opiates, we're going to touch base how that links with the synthetics that we're talking about today. And again, common health effects, those synthetics. Why do people use it and seeking help? We're going to give you some information and just 2 pieces of information, phone numbers that you could find help for a loved one, or if you want more information in regards to organizations that provide treatment. So let's begin the introduction with Claudia. Go ahead, Claudia.
Hello and welcome. Thank you for joining us again this week. As Juan just mentioned, today we're going to be discussing synthetic drugs part 2. So if you were with us last week, then you have a basic and general idea of what a synthetic drug is. But if you weren't, we're just going to go ahead and review it. So synthetic drugs, they are also known as designer drugs. And basically they are drugs that have been chemically synthesized from illicit substances in order to mimic the effect of those substances. In other words, they are copies of other illegal drugs and are usually made in laboratories. The issue is that the drugs are created using man-made chemicals rather than general ingredients, meaning that the ingredients and strength are almost impossible for the user to know. Something important about designer drugs or synthetic drugs is that they're erroneously labeled as not for human consumption, which can be a little tricky for the user and individual. So moving along, we do have Julian, who will cover the Federal Analog Act. Again, if you were with us last week, this is a review. And if you weren't with us last week, let's get into it.
Go ahead, Julian.
Yeah, so the Federal Analog Act was passed in 1986, and it basically says so there's a list of controlled substances on Schedule 1, right? And those are all the controlled substances that are illegal that we know of. So like cocaine and marijuana and all those substances that are mind-altering substances. And at this time, they have no medical use under current federal law. Those are all already illegal, right? So there was a small problem where someone came up with the idea like, oh, well, cocaine is illegal, for example, but what if I make a copy of cocaine and I call it something else, is that still illegal? And the answer before 1986 was actually no. There was no law about that substance that was created. So that's what the Federal Analog Act does. Any substance that's on Schedule 1 that's already a controlled substance, if there's like a copy of that, then that copy is illegal. Also, every single copy of it is illegal. So if there's spice or K2 in a million different forms, they're all illegal. Regardless if they say not for human consumption or if they say like only hang this in your window or something, they're all illegal. Just how you can't like sell meth and say, oh, it's just glitter, right? You can't sell bath salts and say that they're just bath salts, or you can't sell spice and say, well, it's just plant food, it's just this, it's just that. They're all illegal under the Federal Analog Act. Further, California also passed another act, and that is the Health and Safety Code. So that's the Uniform Controlled Substances Act, and basically it does the same thing on a state level. So where the Federal Analog Act gives like the FBI the power to do that on a federal level, the Uniform Controlled Substances Act pretty much allows that to happen on a state level. So like state police or local police or your local government can also stop these things from being bought or sold in any case. So that's briefly what these two acts are. We could go on to the next slide if you want one.
Cool. Thank you, Julian. All right, so I'm gonna introduce a little bit bath salts and MXE and how are those connecting. Um, the MXE and the bath salts are stimulants that are like Julian was talking about. So they're created to copy and emulate to a certain extent and make a cheap version of an actual controlled substance. And in this case, there's methamphetamine and ecstasy alternatives that they make with bath salts. And these drugs are basically a concoction of chemicals that individuals have found to have some sort of same stimulant and same reaction to those. Never have they been tested, and they, basically use the users as a guinea pig lab, you could say, and they go from there. And interestingly enough, every single article that we find, they always talk about how, even though that they're wrapped and sampled with the same label, no two batches are alike. They're always changing, and maybe out of a sudden you hear one batch on the news because it created, very adverse reactions in individuals, and that's usually when the media catches attention and it's reported. But this is always happening because these are not formulas that they have for the most part. So the other one that I was going to introduce is Flocka. Also, it's a similar street drug known as bath salt. It has a whiter pinkish color. It's a crystal form to kind of emulate the same version as crystal. Um, it's has many different names. For the most part, it's Flocka. Some of the news outlets will sometimes call it the kind of like a zombie drug, but it's effects, and they usually don't give out the rest of the information if it was these type of drugs. It's really cheap. $5 per dose for the most part is what has been reported as a street price. And so, like I was talking about earlier, these are drugs that are designed to emulate and form the effects of the other controlled substances, such as amphetamine and methamphetamine. And it's a cheaper, and they're very popular for the most part because of their price and their availability. So now we're going to have Stephen talk about a little bit more on the health effects on the body and mind. Go ahead, Stephen.
Thank you, Juan. So we're gonna talk about dextromethorphan, right? So if you're not familiar with this, what this is, it's basically an ingredient that's used in cough medicine. So it can treat cough, right? So you're gonna see this in like your Robitussin, your Delsum 12 hours, your cough DM, basically all the stuff you can walk into like a Walmart and purchase, right? But the synthetic portion, or one of them at least, because this they can take dextromethorphan and make it into a million different things, right? But one of them is that we've heard about is triple C's, right? I know working in residential and admissions and all of that. I've heard of kids using triple C's, right, or Skittles, or they have a lot of different other names, but so uh, it's important to know like the health effects. This isn't saying that hey, if you take Delsum or Robitussin, like all of these things are going to happen to you. We're not saying that. We're simply saying like the synthetic portion or the synthetic um the
Like,
synthetic drug, the triple C, basically this is what can happen if you do take these things. You were going to say something, Julian?
yeah, I was just gonna say that the effective dose in like NyQuil or Tylenol or whatever like off the shelf whatever off the shelf like medicine has dextromethorphan. Those have it in very small doses, right? They have it in like 15 milligrams or however many milligrams. But the doses where you'll start feeling like hallucinogenic effects are up in the hundreds, so 500 to 600.
Yeah, that's correct. So 100 to 200 milligrams would be a mild stimulant. 200 to 400 milligrams, you may experience euphoria and hallucinations. 300 to 600, distorted vision and loss of motor control. And like Julian said, the 5 to 600 mark, you basically an out of body reaction can occur. But these are some of the other things, triple C's, right? The Skittles, if since they have potential for abuse, you're going to see the hot flashes, the vomiting and nausea, dizziness and lack of coordination, your panic attacks, hyperactivity, slurred speech, feelings of floating, altered sense of time, right? And even seizures, and obviously the one of the ones is impaired judgment when you're under the influence of this. But this is all when you take in high dosages or the synthetic form. So moving along, Juan will be talking about synthetic psychedelics.
All right, so we're going to introduce a version of PCP. Some of us have heard of PCP as
As a
hallucinogen.
Schedule One, yeah, as a
Yeah,
Schedule
correct.
One's a controlled substance.
Cool. Thank you, Julian. But there is also a dark world of a synthetic of a PCP, uh, known as MXE in the streets. And it's a dissociative hallucinogen that has been sold as a designer drug. So it's usually sold in these packets, sold as an alternative to PCP because, again, much cheaper. A copy of it uses some random chemicals, and every single time that, for example, law enforcement tests these batches that are found, the mixes are always changing. So we couldn't tell you exactly what it has uh, as is its potency because they'll find weird chemicals, even up to like uh, chemicals that are used, for example, in pest control and pesticides and that sort of thing. So it's definitely a dangerous mix. Unfortunately, the individuals that manufacture these components don't really care at this point the safety of its users. and
Yeah.
how that's going to affect it. Obviously, they're illicit, so they don't care. But the part of where it's changing, how Julian was talking about earlier, the legislation, how they just will keep changing. They're still illegal. And, as for example, law enforcement agencies try to catch up to the current mixes, that's still an issue. And it's one of the reasons why they're still out in the streets, because they're still able to evade, for example, our mailing system, even though we have a sophisticated system, because the chemicals are still changing. You still have to upgrade software in these machines to capture these chemicals. So
Yes.
it's definitely something to be known that synthetic PCP is much worse than PCP. PCP being itself a hallucinogen dissociative drug. With the enhancements of these synthetic psychedelics that are made to emulate for the reason of making more money and affordability in its users, create a darker world and side effects that accompany it. So let's talk a little bit more. Stephen's going to talk about on the health effects and how these drugs are affecting individuals in general. Go ahead, Stephen.
Thank you, Juan. So again, into the health effects, right? So this is all dose dependent, but it's important to note that you're never gonna get the same batch, right?
Correct.
Um, your some of the health effects you can experience are gonna be euphoria, your drowsiness, your impaired motor skills, right? When an individual is driving, the possibilities of getting DUI or worse, causing an accident where you yourself passes away, or the individual passes away, or innocent bystander, irregular heartbeat, your high body temperature, coma, convulsions, or death. These are some of the effects when you are or when an individual is consuming synthetic PCP. I think one of the important notes to make is I was watching a video where they were talking about fentanyl, and we're gonna dive into fentanyl a little later on in the presentation. But for instance, just picture yourself um, pouring out like a pound of flour and then mixing 5 grains of salt in that pound of flour, and then you mix it and you separate it into small little baggies, right? There's only 5 grains of salt in that pound of flour. There's gonna be batches that are gonna have the grain of salt, maybe 2 grains, maybe 3 grains, and then there's gonna be grains or batches where they're not gonna have any salt at all. So picture the same thing when they're actually using some of these drugs to create the synthetic version, right? So
Yes.
they could, like, if for instance, if you're using Xanax, right? um they could make a batch where they throw fentanyl in it, and because there's no way to actually break up the fentanyl to where it disperses evenly, you're not going to get a batch that every little batch has the same amount.
Mhm.
So, definitely these are some of the things, the coma, the convulsions, or death, these can experience based off of the doses and based off of how much is in the drug.
Yeah.
So, I mean, to the right, you guys can see a picture. This is, synthetic PCP, some of the colors that it could come in. It can come in, in the pills, the powders, but you're gonna see it in like the light browns, the yellows, the pinks, um, and the whites. But here you can see clearly these are like homemade pressed pills. Um, they don't have a branding. They look different. Each one has like their edges look off. They just look homemade. So something like this is definitely something that was made in some sort of, you can call it a laboratory, but it could have been a garage, it could have been somebody's house, things like that. So these are some of the things that you can experience from synthetic PCP. And most of the common effects, we can go into the next slide, Juan.
Yeah, and just to elaborate a little bit, it's sometimes people's bathtubs. When you hear explosion and these weird fires in homes, sometimes it's just, you know, them mixing the chemicals, and they're made with these colors just to kind of create the illusion in our brains that hey, it looks safe. It's a happy color, right, Stephen? Usually medication pills look kind of scary. They're wide, you know, they have these weird
Yeah,
warnings on them. So it's
it could
interesting
be
how
the
they market
same.
them.
It could be the same way when you walk into a candy store, right?
Correct.
You're not gonna get the candy that looks plain. You're probably gonna get the candy that's colorful, that
Correct.
draws your attention. So
Correct. So
definitely agree with
yeah,
that.
these guys definitely have some marketing skills, you could say, that appeal to the audience that they're trying to sell. So
Correct.
just some
Correct.
information. Go ahead, man.
So these are some of the overall common health effects. So you're gonna experience your anxieties. We've probably all seen videos or have seen it ourselves in person, working in a mental health field, or dealing with individuals who suffer from mental health or substance abuse disorders, where you see the aggressive behaviors, right? The drug-induced paranoias, seizures. I've myself have been a witness of an adolescent under the influence of spice and having a seizure because he consumed a spice. Your loss of consciousness, right? And then your nausea and vomiting. But I think the worst ones obviously are going to be the coma and the death, passing away individuals. We have some interesting statistics that are just mind blowing, with how many people pass away on a daily basis, on a yearly basis. If you really dive into it, you can see like that there is a real huge issue going on, not just in California, but within, the world. And we're gonna see some pictures later on of other countries, what the substances that they're using, and how it's affecting individuals. But definitely these are some of the common health effects that come with using some of these synthetic drugs.
Yeah, and one thing that Stephen touched base very strongly is that some of these effects, when you guys have a conversation with a client, emphasize the part that some of these, most of these synthetic psychedelics have long-term effects, and we've seen it, all of us and our clients, helping clients, you know, cope with anxiety, some paranoia, and even seizures, just like Stephen was talking about. But go ahead, Julian.
Yeah, so I'm going to talk a little bit about synthetic opioids. So, synthetic opioids are pretty much any opioid that doesn't come from the poppy plant or like the poppy seed. Um, so that's pretty much what an opioid is. It's very broad. Um, Illegal synthetic opioids are opioids that, although they are a copy of whatever opioid, like for example, if I'm trying to make a copy of morphine or something, and I make that at my house because there's no medical purpose to it, then it's illegal, right? However, if like Pfizer or something makes a copy of an opioid and they do market testing and research, and it's it turns out to be effective to treat like whatever disease or whatever chronic illness, then that's not illegal because now it has a medicinal purpose. So even though they could be, you could view them both as almost the same thing. One is illegal and one is not illegal because of like the way that it's being used. So it's the same thing when let's say I get a bottle of OxyContin or something, but I don't have that prescription, right? So it's illegal for me to have because I'm not the person who is supposed to have that controlled substance. And so that's kind of the area where these a lot of these synthetic opioids fall into, is that some of them are legal, some of them are not legal. However, if they're not prescribed for you, they are illegal for you to have.
Yes, and
Yeah,
we
Juan?
brought them up because of the connection with synthetics and Xanax. A lot of clients and schools that we've served in the local area have reported increased overdose scenarios, and Xanax was one of the main, or it wasn't Xanax, it was the synthetics that were embedded in Xanax,
Right.
sold as Xanax.
So there's actually a massive problem right now with these synthetic opioids with fake Xanax pills or pressed Xanax pills, because Xanax are benzodiazepines, right? Um, so they are not opioids. However, they have sort of opioid-like effects. So to the outside, what do you see when someone is taking a lot of benzodiazepines? They're kind of low. They're kind of like low energy, kind of slower, maybe talking a little bit less. Maybe they're a little bit like loose, unwound, or something like that. And then, well, let's say I'm a drug dealer or something, and what am I going to look at? Um, what Let's say I want to sell that person a fake Xanax pill. What is similar to that? Oh, an opioid, because it also is an overall like depressant. You get down, you get slower, and things like that. So Xanax pills that are fake, a lot of the time they are cut with fentanyl. And so just
Correct.
how we reviewed a little while ago about like the 5 grains of salt in 1 pound of flour, how you can mix it as much as you want, but like imagine if it was in a bowl and you had to mix it with a spoon, you're not going to be able to break down those 5 grains of salt, right? So there are going to be Xanax pills that have, or fake Xanax pills that have no fentanyl in it, and there are some that are going to have massive doses of fentanyl, and they could all be from the same batch, and just that some are deadlier than others just because of the mixing process and how they were made. Yeah, Juan?
Yeah. All right, so we're gonna move ahead and talk about the short-term health effects on injectable opiates. Go ahead, Julie.
Um, so one last thing is that the way that you'll see that someone is using injectable opioids is because there will be like injectable sort of paraphernalia around them. So maybe like a burnt spoon, maybe like a syringe, maybe things like that. So that's the biggest clue that you'll get for from injectable opioids. A very short-term health effect from these injectable opioids, an immediate short-term health effect, is that because the injectable drugs are used by breaking the skin, they leave the user susceptible to skin infections. And then also because they're not sterile and sometimes they're using sort of a caustic substance, like an acidic substance that's found in a lot of these injectables, there can actually be really severe and terrible consequences. Some of these pictures, you can go to the next slide, Juan.
Okay.
Some of these pictures that we're gonna show, it literally looks like someone injected themselves with acid, just because these substances are so caustic. They're so dangerous, um, and just because they're so reactive, they'll have like an effect on the skin immediately there, but they won't have an effect on like the rest of the body so much because it's sort of like burned, and then the reaction that was going to be had was had on the top of the skin. So luckily it didn't travel to like the heart and things like that. But unfortunately, sometimes a user continues to use. So these are really graphic images. If you want to take a second to look away, feel free to take a second to look away. Um, Juan, you could go ahead and show the next screen.
Yeah.
So these pits and these holes in the skin are injection sites. And someone can actually use these drugs for a really long time and have these pits and these holes in their skin and be almost fine, besides just having sort of like craters on their skin. If you look at the one on the top right, you'll see that that person doesn't just have holes, they also have scars, meaning that those were holes at one point and they actually they did them so long ago that they've healed and scarred over while the person continues to use these drugs. So a person can continue to use these drugs for a really long time, even though they're having massive effects on their skin, on their health, and on their body. And then you can go to the next slide, Juan, so we don't have this up too long.
Got it. Go ahead, Stephen, on the fentanyl health effects.
All right. Just for those who looked away, you're able to look back now.
You can come back now.
The pictures are gone. Yes. So definitely fentanyl, right? So we've all at some point have heard of fentanyl, either on the news or working in the field or just simple stories in the community. Since it's being thrown into these other medications, right? Like how Julian was talking about the press Xanax, right? So these are some of the health effects that come from using fentanyl. Your drowsiness, nausea, confusion, constipation, sedation, problems breathing, unconsciousness, right? Obviously, we didn't put in the death because or overdose because we know that that is something that happens very often. At the bottom right, we've probably seen this type of picture 100 times, right? We can see that there's a penny there and the lethal dose when it comes to fentanyl. And just going back, to the flour situation, just imagine dropping that amount of fentanyl into a pound of flour and trying to disperse it evenly. It's not possible, at least not by the local drug dealers or the local person that's making this in their garages or laboratories, wherever they're making it, right? They don't have the machinery that's sophisticated enough to evenly disperse the fentanyl, and that's why we are seeing, like with the press Xanax, we are seeing a lot of situations where when adolescents were going to school, right, you had kids that were overdosing on Xanax in the bathrooms at school. And I know that when they would come to us, I would talk to them about what they would tell me what would happen, and I would just simply talk to them about it. We would have a conversation. They realized that it was an issue, but the situations with those is I would always tell them, like, hey, if you end up in the hospital, then the doctors are mandated reporters. If something happened, then they can do these reports. And kids just would either sometimes listen or sometimes continue to use it because it hadn't happened to them, right? They never thought that it would happen to them. But you hear that quite often where some individuals say, that's not going to happen to me, you know or you're going to hear them say, my drug dealer is not like that, right? I know, I was talking to my colleagues, Juan and Julian, about Tyler Skaggs. I don't know if anybody remembers him from last year. He passed away. He was a Los Angeles Angels pitcher. And even this wealthy person, that has the money to pay for high quality drugs, he sadly passed away from a drug overdose. And they ended up finding out that it was somebody from their main office that was supplying him the drugs, and now this person is being charged with basically his death. So definitely these are some of the things that we need to know about, because that person that sold those drugs to that pitcher didn't know that there was going to be a fatal dose in the synthetic drugs that he was giving him. And sadly the pitcher passed away, and now this person is going to have this legal battle with having to defend himself and everything that comes from that. So we can go on to the next slide, one.
Correct. And it's a good point, Steve, that shows that this illicit world of drug usage trespasses all types of economic status in individuals. Doesn't state to with it's not allocated to one. You hear it all the time. Even not even sports, also rappers. You hear them that pass. Unfortunately, due to overdose. All right, go ahead, Stephen, and tramadol.
So tramadol health effects, right? So I know tramadol, it's medication. It's used to treat moderate to severe pain. It's prescribed, but going back to the topic at hand, right? It's synthetic opioids. So definitely these are things that can be taken um, and made into a million different things, right? To either enhance it or to make a profit, to make more of a profit, right? So you take tramadol, you break it up, maybe one pill, you can make 10 pills out of it, right? When you add, like, my colleagues were saying, where they throw in pesticides and all these other things into this concoction that's made and then pressed and then sold as quote unquote tramadol, right? But this is some of the effects that you can get from tramadol. So definitely the dizziness, headaches, drowsiness, nausea, vomiting, constipation, lack of energy, sweating, and your dry mouth, right? But obviously, going back to the synthetic portion, we're not saying that tramadol is bad and you're going to experience all these things. We're going back to the synthetic portion, right? And just saying, hey, this can be taken and can be made into 10, 15, 20, 100 different types of drugs, or what's the synthetic version of it. So the next slide, we're also going to be talking about methadone, the health risk behind that. So you're going to have your mild and then the serious effects, right? So your mild effects can be drowsiness, dry mouth, lightheadedness, your urinary retention, your gastrointestinal distress, um, sexual impotence. And then your serious side effects can be irregular heartbeat, tremors, your unstable gait, fainting, seizures, anaphylactic reactions, or death due to overdose, right? So definitely these are things that it is made to help certain individuals with, you would say, heroin addictions when they're having withdrawals, but this is all either synthetic or when it's definitely abused. And then going into some of the common health effects for synthetic opioids. So the feeling of euphoria, pain relief, drowsiness, sedation, nausea, and overdose or death. And it's important to note that because these things are being made in laboratories, quote unquote, there's it's very difficult for law enforcement, for scientists, or for doctors to even keep up with the different things that are being put in these things. They have a base, but there might be, you know 15 other ingredients in this one thing or one substance that they're using. So that's why we're seeing a lot of overdoses and a lot of deaths, because we're not able to keep up with it, in a sense, because whatever gets banned today, there's 100 different versions of it tomorrow. So definitely these are some of the things that we need to pay close attention to when talking about synthetic opioids or synthetic hallucinogens.
Definitely. And just a quick side note, all of these, some of these drugs have medicinal purposes, like methadone being used in medically assisted treatment. So it's kind of, we're just giving the effects of the illicit versions that individuals tried to copy by mixing just a bunch of chemicals together. So,
So, Stephen covered a lot of the health effects, right? We've heard about synthetic drugs. We know that they pose a danger to the user as well as to the public. But this brings us to the big question: why is it that people still use? So, like I said, we know it's a danger. It's not something that should be consumed as it erroneously is labeled. But why do people use? So, some users have reported that it has made the user feel euphoria. So, if you don't know what euphoria is, it's just a sense of in where people report that it makes them feel happy. But guess what? This euphoria feeling does not last forever. So, it's not such a great uh, thing that our user could feel since it's only temporary. It also has been reported that it causes an increased wakefulness or concentration, as well as elevated sex drive. Users have also reported hallucinations, increased talkativeness, empathy, or what other people may call a rush. But as I mentioned, the outcomes of this, when you pay attention to the health effects, it really doesn't seem worth it. But moving along, we're going to discuss contributing factors to why people use. So by this slide, I know what you're probably thinking. You're probably thinking, okay, synthetic drugs, the Analog Act, they pose a serious danger to the user. But why is it that still people continue to use? What are some contributing factors to why people use? And that's great that you're thinking that. And if you're not, it's totally fine, but we're going to jump into that. So this slide really covers just some of the contributing factors to why people use illegal substances. So your family tree, right? As you can see, like family plays a key role. So this isn't to say that if you grew up in a household where your parents were drug users, you're automatically going to be a drug user. That's not what we're trying to say. But we are trying to say that coming from that background is going to increase your likeliness of engaging in illegal substance use. The top image shows a girl where she's just sitting, she looks a little bit alone. So a lot of the users and a lot of the people we talk to, when we ask them, hey, why do you use? A lot of them will say, well, I was just bored, or I didn't really have nothing to do. I felt a little bit lonely. I was just in my room and, there was nothing to do. So that's a key contributor. And that's why when we talk to parents or just youth in general, we always tell them, like, it's great to have a schedule. It's great to have certain coping skills and, like, hobbies in order to implement them when you're feeling bored or lonely. And then your mental health. So your mental health plays a key factor towards contributing factors onto why people use. Your mental health is important, and a lot of the times we touch a little bit of the basis of it, but we don't strongly emphasize how important it is. And today I want to remind you guys, your mental health is extremely important. It's vital. You need to have a stable mental health. You need to be able to emotionally, mentally, physically, and socially be in a good health. And then socioeconomic status. So if you see the image below, it's kind of like the Earth planet, right? And there's money, there's different types of money. So let's be honest, socioeconomic status, SES, that really plays a role. The area code in which you live in does have a great impact on why certain individuals might use or not. This isn't to say that if you live in a poor area, you're automatically going to be a drug user. That's not what we're trying to say. But we're trying to say that the likeliness of somebody using is increased in those circumstances. And this is only because, let's say you compare it to another area and where it's a little bit more healthy. They might have more activities for the youth. They might have more extracurricular activities in school. When you start comparing it, you can see the difference. And then the green check mark on the right. What does that mean? Availability. Let's be honest, drugs are very available, and that they're so abundant in communities, and that's also a contributing factor to why people use. And lastly, peer pressure. So the people around you, your friends, the people you go to school with, the people you work with, just individuals within your community that you talk to play such a key role. And let's be honest, even as adults, I know myself, being able to say no, it's not that easy. It seems like it should just be a 2-letter word, but really it's not. Sometimes there's so much more to it, and peer pressure does play a key role in whether or not somebody uses or engages in illegal substance use. So moving along, let's discuss seeking help.
Thank you, Claudia. So we're going to touch base a little bit on seeking help. and the addiction recovery. So one of the most difficult exercises is training our minds. I think it's easier to train our bodies, to do 100 push-ups a day or to do sit-ups or to run the mile. Don't ask me about mile time. Been working on it, but it's still not as good as it used to be when I was 15, 16, 17. But working towards a goal. And in this point, training our mind to asking for help is one of the great tools in mental health and recovery. And some of these tools that we could use personally is start the conversation with that individual, or if you find yourselves in substance abuse, asking for help, reaching out to a substance abuse counselor. You could talk to us. We'll give you our contact information. You can give it out to anyone. They could talk to anyone in our facility. There's always referrals and services that we have to provide to the community. Find help online. One of the greatest tools of the century. We have a database of so much information stored. Um, some of it is awesome, amazing. We have, if you have a question in mind, we don't have the answer, you could always look for. But there's always the other side to it, of course. And the National Referral Service, and that's the National Helpline. It's a confidential 24/7 service that has a huge catalog of all the treatment facilities and organizations that provide services for your location. If you find yourself in Los Angeles, they have plenty of information. Or if you find yourself in New York City, Florida, Miami, from one corner to the other corner, their inventory is always updated with information from these organizations that provide help. Phoenix House, we provide a wide variety of services to the youth and adults in the San Fernando Valley. We have outpatient support groups and mental health services. Our outpatient support groups are really fun. We try to make them engaging, and we try to promote education. So not only we're not trying to convince these individuals to change completely from brutal force, but we try to convey information in educational steps that they're able to understand, steps that we've learned in the field, how individuals are able to communicate, and even using social media and current trends, to convey the information. So definitely, and then another key is if you are, for example, a provider of some sort, always that listening part always seems to work. Greatest tool ever. Some of our resources that we use to put together our presentation, and we're gonna have Stephen that's gonna give out just the Phoenix House services that we have a little bit more detailed. And at the end, we're gonna have our contact sheet. Go ahead, Stephen.
Thank you, Juan. So we're gonna dive right in. So one of the programs that we have is our outpatient substance abuse program. So that program, it is for adolescents and young adults. We currently have just kicked off what we're calling as the fall semester. Um, we're trying to we actually all teamed up and kind of came up with this creative idea of having like a theme. So we have like workout Wednesdays, freestyle Fridays, things like that. So they're trying to make it interactive with the kids, because we understand that, hey, COVID-19 is happening right now. We're not able to do it the way we used to do it. We're face-to-face interactions, activities with the kids at our facility, things like that, right? So we have to somehow get creative with it, through a virtual platform. So we definitely came up with these great ideas where they, the adolescents that are in the program right now, they join virtually, and they do some sort of, either workout Wednesday activity. Freestyle Friday could be like, either painting, or I know that one of the AOD counselors, he's going to be doing a video, or he's going to be doing a virtual video with the youth that are in the program, on cooking. So he's recently changed his lifestyle, so he's going to be doing some cooking videos with them. So we're trying to get creative with it, and definitely making it fun. Obviously always hearing them out, like, hey, what did you like, what you didn't like. So those are some of the things that we're doing in our outpatient substance abuse program. And then our mental health program, we're definitely still that one's still operating. We have immediate openings that we have expanded the mental health team. So they're definitely, taking new referrals. Um, and they're also, we have some great therapists that work with us. I mean, I've been at Phoenix House for 5 years, and I've seen, people come and go. But I really see the team that they've developed, and the individuals that are there now, and they're really, it's a lot of times you might hear, um, definitely therapists want to move on and better their situation by doing the private practice and things like that, right? But definitely our therapists are compassionate, understanding, and are here to help, individuals. So if you guys know anyone that's looking for mental health services, definitely we can connect you with Jenny Sanchez. Our outpatient substance abuse, we can connect you with Lolita Otley. And then we have our wraparound services. With wraparound, you do need a probation or DCFS referral. But we do have that program. If you guys know anyone, or if you work in that field, definitely, we do have that program. Amazing team that's just individuals who have been working together for quite some time now. So it's really cool. Actually, my wife works in the wraparound program, so it's an awesome team. So one of the other ones, it's match services, right? If you guys know anyone that's suffering from alcohol or opioid withdrawals, definitely please give us a call. We can answer any questions. We can definitely link you with a program that's going to meet the individual's needs in the area that's probably closest to them. I know Phoenix House is located in the city of Lakeview Terrace. Not everybody lives in Lakeview Terrace, right? So we definitely want to make it convenient to the individual when they are receiving these services. And then in the next slide is our contact information. So you're gonna have Sarah Green, our program coordinator. You can email her, about anything. Currently she is on vacation, so you might get like a reply back if you do email her, letting you know that she won't be back until, I believe, the 19th. But she is available when she does come back. We also have Morgan Wallace, our clinical trainer. She's actually online with us, I believe, for every presentation, and she's here to also any questions or anything that you might have. She's able to help us out with that. And then you have the amazing team, right? The Juan Jimenez, Claudia Buenrostro, Julian Olmos, and Stephen Flamenco. We are the prevention and your team at Phoenix House. Also, to the right and to the left, you're going to see the Facebook logo and the Instagram logo. I definitely want to encourage you guys, just give us a follow. We're always posting drug facts, flyers for our presentations that are coming up, anything that we feel our community should know. I know when we were doing the food pantries, we were posting things, of that nature. And anytime we have a resource, we're trying to put it on there so that we can let the community know. And I think one of the easiest things to do, if you're a provider or if you work in some sort of field where you're working with families, it's always having, this connection with different agencies, because, I might not have the same resources as, Juan or Julian or different agencies. And when I do start making these connections with different people, then I can get those resources. And it's not for us, but it's for the families that we serve, right?
Yeah.
So definitely give us a follow. I encourage you guys.